It's brutal when a child develops cancer and dies of that cancer. It is also brutal when a child develops psychosis and cannot access care that may be completely life-changing. And essentially, that child's future trajectory dies with that onset of psychosis. So I think both of those stories are tragic. There are a lot of human faces to this story, and they don't look that different than the human faces to other stories that are heart-wrenching. So when a 14-year-old kid starts hearing voices and is frightened and paranoid and bewildered by what's happening. And then the next thing they know, they're being handcuffed and sort of dragged to a hospital where they're very agitated and they get restrained physically, literally tied to a gurney and injected with medication, because that's sort of what has to happen if somebody's that agitated in a hospital setting. And then sort of come to on an inpatient unit where the other people with a psychotic illness that they're seeing are terrifying examples of what psychosis might turn into. That's a terrible story, and that story is completely changeable by changing systems of care. That story is treatment as usual right now, even today, and it doesn't have to be. So care for psychosis, I mean, it's not mysterious, it's actually very common sense. Like I often say, coordinated specialty care is not rocket science. It's kind of like if you could just think in your mind, what would be really good care for somebody going through this? That's what it is. So someone comes in, they're having really confusing, scary experiences. We greet them very warmly. We introduce them to the team. They come and sit for an interview with their therapist and an interview with their new psychiatrist. They tell their story. We talk to them about, what is psychosis? Why are they here? What can we do for them? What are their goals? What are we gonna do to help them achieve those goals? And their goals are often like the goals that any teenager would have. I wanna go to college. I wanna be a rap star. I wanna open my own restaurant. I mean, they're not crazy goals. They're the goals that every 16 and 17-year-old have. And so then we set out, like, how do we get you there? So we got to get you back to high school if you want to go to college, right? Like, let's work on that. So we've got a supported education specialist. You're going to need a little bit of support going back to high school. So we've got an occupational therapist who can provide some of that support. It's scary to have psychosis. You don't know anybody else that has psychosis. So we have a peer specialist to help sort of guide them through that experience. Medications can be helpful, but it's kind of scary to take medication. So we take a very slow-moving approach with that. They meet with the psychiatrist very, very often in the beginning, whether or not they agree to medication. None of that is scary. And then the therapy itself is, in the beginning anyway, very structured, very cognitive behavioral. Let's kind of just talk about what you want to do, what you enjoy doing, and what are the obstacles getting in your way, and how can we break those obstacles down into things that we can work on together to help move them out of the way of your life path. It's extremely unmysterious, actually.